I didn't want to give up. I was strong enough to, but eventually I had to give up. My body was sore. I couldn't continue anymore. My skin disease is Iriopsia areata. My whole skin was full of sores. My feet were swollen, my whole body. This part was like this, big. I would like to work, but I can't. I'm too scared.
With eczema, it's one of those conditions where it's quite unpredictable, you know. So now it's more like, okay, fine. You sort of, you tell yourself that you're managing it, but you don't know when it comes back, how strong it will come back. I don't want eczema to actually stop me from living my life, basically, because it's always going to be there, regardless.
I can manage it by not looking at my wounds and putting moisturizer.
If we could get, more assistance from medical aid, because it's something that you live with every day. You don't know when it will end.
I've got to be more aware with where he is, who he's with, because he has such a long list of allergens, environmental allergens as well. Things like play dates, are there cats? How many cats are there? Is there a sandpit that really aggravates the skin if he plays in sand?
I just itch. I try not to, but it's just so itchy. I try not to.
Scratch.
Try not to scratch.
Atopic dermatitis is one of those visual conditions. So to some extent, you can hide the inflammation, you can hide the rashes, you can hide all of them under clothing. People can't necessarily see the physical flare-up. The pain is still there. The emotional turmoil is still there. It consumes your entire life, physically, mentally, and emotionally.
Advocacy is crucial for atopic eczema because it raises awareness, encourages funders to prioritize the condition, drives research, and improves patient care. Atopic eczema is a chronic inflammatory skin condition affecting millions globally, but is often under-recognized and misunderstood. Advocacy helps to shine the spotlight on the condition, ensuring that it receives the attention it deserves from healthcare, policymakers, and the public. Effective advocacy can lead to increased funding for research, better treatment options, and the development of comprehensive care guidelines. By sharing personal stories, patients can humanize the condition, helping to break down stigma and dispel myths. This in turn fosters a more supportive environment for those affected and encourages early diagnosis and treatment. Professionals can get involved in advocacy by collaborating with patient organizations, contributing to public awareness campaigns, and educating both patients and their families. They can also advocate within their institutions for better resources and support system for managing atopic eczema. Patients and their families can encourage an advocacy by participating in awareness campaigns, supporting research initiatives, and using social media to share their experience. By working together, both patients and professionals can ensure that atopic eczema receives the attention and resources needed to improve the quality of life of those affected.